What does hormone imbalance mean?
Though normally when people are talking about hormone imbalance, they're generally talking about female hormones, so estrogen and progesterone, and the other hormones involved in the menstrual cycle, and that imbalance of those hormones can affect things like fertility levels and the regularity of menstrual cycles.
How does a hormone imbalance impact the body?
So it depends which hormones are out of balance. For example, if you take the thyroid, for example, if your thyroid is underactive and you've got low levels of thyroid hormone, people tend to feel very tired, put on weight, feel cold all the time. Conversely, if their levels are high, they tend to lose weight, feel anxious and jittery, and feel hot all the time. In terms of the hormone imbalance, in terms of the female hormones, usually an imbalance will result in irregular periods, subfertility, so difficulty conceiving, or maybe the symptoms typical of perimenopause and menopause.
What hormones are specifically tested?
So you can test pretty much any hormone level depending on what symptoms you've got, but the most common hormones that we see tested usually in sort of clinical practice, for both men and women, it would be thyroid hormones. This is because thyroid problems are actually quite common, and the symptoms of either an overactive thyroid or an underactive thyroid are fairly vague and non-specific, so we test it a lot, particularly if people are complaining of symptoms like tiredness or weight gain, or even weight loss or feeling anxious. Other common hormones that we like to test and that people are interested in testing are the sort of sexual hormones. So for women, that might be their estrogen levels, or some of the levels, some of the hormones involved in menopause, like FSH. For men are often interested in testing their testosterone levels, particularly if they're experiencing symptoms of lack of energy and low libido.